If you have been putting off seeing an allergist because you're not sure what will happen or you're not sure whether your symptoms are bad enough to make an appointment, this video is for you. I'm Dr. Karen Kaufman. I'm a double board certified allergist and immunologist, and I founded Kaufman Allergy, Asthma and Immunology in Vienna, Virginia, because I believe Northern Virginia patients with complex allergic and immune conditions deserve something better than what was available. Today, I'm going to walk you through exactly what happens when you come to see us, from the moment you schedule to the moment you leave your first appointment. Here's what I hear from new patients all the time. I've had these symptoms for years. My primary care doctor keeps giving me antihistamines, but nothing's really working. I didn't know there was more that we could do. Or, I was nervous about coming in. I thought it was going to be a bunch of tests I didn't understand, followed by a list of things I could never eat or be around again. I understand the hesitation. Medicine has not always done a great job explaining what's actually doing and why, but that changes here at Kaufman Allergy. My philosophy, and the philosophy of every provider on our team, is that clarity is a clinical outcome. You will leave your first appointment knowing what's happening in your body, why it is happening, and what we're going to do about it. Our team includes 3 double board certified physicians and 2 nurse practitioners, each with a doctorate in nursing practice. What does double board certification mean? It means we've passed rigorous external exams in both allergy and immunology and either internal medicine or pediatrics, not just completed a residency. We have been tested and validated by the national boards in our field. We see both pediatric patients and adult patients. Complex cases are exactly what we're built for. The kind of cases most practices refer elsewhere, we handle those here. When you schedule a new patient appointment, you'll receive intake forms through our portal, and you can upload your photo ID and insurance card prior to arrival. That makes the check-in for your visit quick and easy. The more detail you can give us about your health history, family history, home environment, medication allergies, and an exact list of the medications you're taking, the quicker we can get you to the reason that you're here to see us. Your first visit is a full consultation. Plan for it to take about 30 minutes. We begin with a thorough history. I want to understand the full picture, not just the primary symptom, but everything that's connected to it. When did it start? Does it track with seasons? Does it get worse indoors or outdoors? Are there food involved? Is your sleep disrupted? Are there other family members with similar issues? You get the idea. It's not small talk. This is how we arrive at the correct diagnosis. We'll do a focused physical exam, examining your nose, throat, ears, skin, heart, and lungs, depending on what your symptoms suggest. I'm looking for physical signs that support or refine the history that you've given to me. Depending on your symptoms and the clinical picture at that point, we may recommend allergy skin prick testing to be done either at your first visit or at a subsequent visit. Skin testing is an epicutaneous test where a small amount of allergen is introduced into the skin surface on the upper back with tiny sterile metal points called lancetters. Positive testing feels itchy, and after 15 minutes when we read the results, positive testing reveals a bump and an area of redness at the location of the relevant allergen, which we measure with a ruler and record the results. After we're done, we clean up the skin, which takes away most of the itching. The test is quick, it's largely painless, and it's extremely informative. Depending on what's going on, we may also order additional testing via the blood called specific IgE testing to test for allergies. Additionally, other tests may be ordered depending on the reason for the visit and what specifically is being evaluated. Before you leave, you will have the answers. Not just let's see how this medication works and check back in a few months, but a specific diagnosis, a specific plan, and a specific timeline. We will explain the diagnosis on an immunological level, what treatment options are available and why we're recommending the ones we are, and what success looks like for your specific case. We approach the entire plan with a goal of shared decision making. Now let me answer a few questions that I hear all the time. Do I need a referral? Well, that depends on your insurance plan. Many of our patients are self-referred, but some plans require a referral. If you don't know the details of your insurance plan, check to see if it's mentioned on your insurance card or call your insurance provider to ask. Will I have to stop my antihistamines before the appointment? For skin testing, yes. It's recommended to stop antihistamines 5 to 7 days prior to allergy testing. When allergy testing may be done at the first visit, it's best to plan ahead. But when allergy testing is being scheduled for a separate day than the first visit, the antihistamine should be stopped accordingly in advance. Asthma medicines should always be continued, and if you have questions about other specific medicines, please ask our office. Do you see children? Yes, we see both pediatric patients and adults, from infants all the way through the elderly years. What if my symptoms are mild? Is it still worth it? Yes. The value of an allergy evaluation is not only treating severe reactions, but identifying the mechanism driving your symptoms. Once we pin down a diagnosis, we can address appropriate environmental controls, medication therapy to treat the right symptoms when appropriate, and we can also discuss ways that we can work together to fix the underlying problem. If you've been on the fence about scheduling, I hope this gave you a clear picture of what to expect. A new patient appointment at Kaufman Allergy starts with a physician who takes the time and has the training to understand the full picture. We are accepting new patients and look forward to seeing you in the office. The link to request an appointment is in the description below and can also be found on our practice website, kaufmanallergy.com. We serve adult and pediatric patients through Northern Virginia and the greater DC metro area. Subscribe to this channel. We release a new video every week, and if you have a question you would like me to address in a future video, please leave it in the comments. Share this with another person in your life who this may impact. We would love to be able to inform everyone in our community so everyone can receive the care that they deserve. Thank you so much for joining me, and I will see you next time.